Hello class. Now we will do the female reproductive system. I got two parts to this. Just thinking back, we talked about sperm. I wonder if you guys can think of a way, if you did in vitro, if you were going to take a sperm sample, if you could help pick the sex of the baby somehow. Is there a way, is there any difference between male and female sperm? Or I guess I gave it away there, talking about the chromosomes. Well, it turns out, the female will be XX and the male will be XY. One thing I know you know, is that the Y chromosome is really small compared to the X chromosome. So if you took a sample and spun it down in a centrifuge, you would expect the heavier would be the female sperm to collect more near the bottom, and the relatively lighter male sperm would be more towards the top. So in fact, it is true. You can centrifuge a sample, and because males have that Y chromosome, it's going to be lighter than a sperm that has two copies of the X chromosome. So kind of a fun fact there. So one big difference between males and females reproductively is that males need to produce sperm. They need to be able to store it. They need to be able to put it into the female where it can find an egg. That's about it. Females need to produce the egg, make sure it can stay viable, and then have a location for fertilization. And then they need to be able to incubate that egg until it turns into a whole little person. So for months and months. So they have the additional task of having to carry a baby. And then after that, to nourish it with breast too. So males producing sperm, get that sperm to the females. Females got some more tasks that need to be involved for successful reproduction. Yeah, so we're going to get to these parts here. I like this, expels mature fetus. Very romantic, huh? Childbirth expels the fetus. It doesn't sound very, sounds a little rough, really. Right. So very interesting looking at this. Males reach puberty, and then they produce sperm from that point on, even into old age, produce sperm constantly. Women reach puberty. It's called menarche, and it's actually some thought that it's beginning earlier than it did, 50, 100 years ago. With some people thinking that the hormones we put into cows to produce more milk are going to influence girls into having more hormones in their system. There's other chemicals too that mimic hormones that could be doing that. But there comes a time where the first period is where puberty begins, and then once a month an egg is prepared and made ready. So 12 times a year a woman has a potential to get pregnant. And then that continues on. And if you do the math, until menopause, around age 50, we're talking about 300-400 eggs in a lifetime of a human female. Just a handful. And we'll see, we start out as a fetus with 5 or 6 million eggs. And so it's really a narrowing down process to get to what's left there. And so this kind of a cycle that we have, humans, is a menstrual cycle. And it's unusual in mammals. We produce an egg, we get fertile once a month, and it's really hidden. There are subtle changes, and if you're trying to conceive a baby, you're familiar with taking your temperature every morning, or looking at cervical mucus changes, or just reading a calendar and seeing about midpoint, about day 14, you should be ovulating. But other animals that go into heat, estrus, like dogs and cats and deers and bears, did I say deers? Of course I meant deer. They go through a period where they advertise their receptiveness, and there's mating takes place at a certain, kind of seasonally. Whereas humans could get pregnant at any month of the year. Compared to a male, we're talking about numbers here. We're talking about 300-400 eggs. 525 billion sperm are produced in the lifetime of a human, so male. Well, we're talking today about the ovaries. The next lecture I'll get to the uterus. But the ovaries are homologous to the testes, same shape, relatively same size. They've got a tunica albuginea on them. But then, of course, there's some differences. The ovaries produce the ova, or the eggs, and also hormones, your estrogens. So the ovary is low in your pelvic cavity, and the whole ovaries and the oviducts and the uterus is suspended into this broad, flat ligament called the broad ligament. And that's extension of the parietal peritoneum. It's just going to go across and kind of keep things tethered there. And then two other ligaments you need to know for looking at the ovary is there's a real solid cord connecting it to the uterus called the ovarian ligament. And there's a thickening here, the broad ligament, that kind of comes up, that goes out with the peritoneum, and that's the suspensory ligament. It's going to suspend the ovary. Yeah, so that kind of gives you an idea of what's holding the ovary there. And you can see the oviduct, also called fallopian tube, coming out there. It's got little fingers at the end. We'll talk about that. And the ovaries do, like I say, it's homologous to the testes. They start out up by the kidney, and then they descend down, and they don't leave the abdominal cavity. They stay down there. This is what an ovary looks like. Basic kind of diagrammatic little sketch of it. And we have, much like we had in the kidneys, adrenal glands, we have an outer cortex, this outer part, and an inner medulla. Medulla will be this inner part. You see the blood vessels go into the medulla. The cortex is what contains all the ova, all the eggs. It's very cellular. The cells are going to make the hormones and such. So here are the follicles. You can see primordial ones are just the egg with just a squamous layer of these follicle cells around it. So you got hundreds of thousands of these. And some of them will be called up. Every month, about 20 or so will start developing and getting bigger and bigger. And what you have here, you can see a primary follicle. Then a secondary follicle is going to start to get some fluid build up in it. It's like lake forms. And then by the time you look at a mature follicle over here, it's got a huge lake here of water, right? And the egg is held up on a little column, like on a little cloud like that. And I talked about 20 or so are called up, but only one, usually one or two, will make the cut and actually ovulate. You can see the egg bursting out from the ovary there. And then the egg is floating free in your abdominal cavity. It usually gets picked up by the oviduct and has the potential of being fertilized. So yeah, that outer cortex, you have just thousands and thousands of these ova, eggs. And their eggs are always surrounded by a follicle. A bunch of cells around it. They're going to nourish it, protect it. And as the ova are picked to develop further, those cells divide into many layers and become the cells that are going to secrete the hormones, estrogen and progesterone. So those follicular cells are little hormone producers. And when I talk about like a few are picked, there's no real picking. I just say that. We don't know which primordial follicles are the ones that will continue to develop. We don't actually know that, but of all of them, only a few, usually only one ovulates per month. Medulla, indeed. There's the ovarian ligaments. It's going to be connected to the uterus. And then the suspensory ligament that has the ovarian artery and vein is going to be coming down from above. So this thing hangs there next to the uterus. And then there's a big tube that's going to come around, the oviduct, that's going to be ready to receive the egg as it is ovulated or expelled from the ovary like that. And then what happens to these, to the rest of the follicle once the egg is gone? Does it just shut up shop and go retire? It does not. These cells will become the corpus luteum. And corpse means body, and lutea means yellow. So this is the yellow body. And it's going to make primarily progesterone, this hormone that's going to be sent out. It's going to tell the uterus, hang on, we got an egg coming, we could need you. And if about a couple weeks goes by, there's no implantation, doesn't get any signals, the corpus luteum will break down into just this white body, corpus albicans, like albino white. And that's just kind of a scar, does nothing. And this continues monthly, monthly, monthly. Once one is ovulated, the middle of your cycle, the next ones are starting to get ready for the next cycle, right? And the follicle from that egg that was joyously released will become this yellow body that will produce hormones until you decide that not going to have a fetus this month, and then it's just going to degenerate. Here's a micrograph of an ovary. Now we're probably looking at a cat ovary or something like that, because you can see many mature follicles here. So you see the big lake here, and here's the ova right there. So I know there's many. It could be a person on fertility drugs. You know, could be, I don't know, but I doubt it. And then it shows a corpus luteum, kind of this. That's what happened to one of these follicles from last month. The surface of the ovary has a layer of cuboidal cells, and then I wanted to show you that it's just like the testes in having this tunica albuginea. A really tough, lots of collagen, just like on the testes, that gives it a real toughness to it. All right, here's our first pathology. When you think about some of the issues, diseases and pathology with female reproductive system, you can think of endometriosis. Maybe some of you know or suffer from that. It's where the endometrium is supposed to be inside the uterus, starts growing on the outside of the uterus or on the duct or something like that. It can be very, very painful. You can have ovarian cancer. You have fibroids, these benign kind of tumors that form in there. If you look at this, you guys have any idea what's going on? You can kind of see that these look like bubbles. And in fact, ovarian cysts, quite common. I don't have the statistics, but very, very common. And that ovary is highly active, and every time it spits out an egg, it forms this crater. And some of these things can get, these like fissures and cracks can get covered over, and fluid can start building up. There may be many reasons, but you can have a cyst that fills up, and it can be painful. You feel it in one of your lower quadrants. And they can go in and fix it if necessary, or again, if it's minor, just kind of a wait and see. Yeah, and here's a person with this 93-pound ovarian cyst. A very big person, so able to fit in there, but it's impressive. And taking a look how they can get to them, they can do laparoscopic surgery. They can go in like this through the belly button. They can actually go through the vagina at the end of it and make an incision, so it's not even anything you can see on the outside. But they can get to those ovaries to take care of a cyst. Yeah. Do you guys know what it's called when you remove the uterus? It's a hysterectomy. Part of it, all of it. You remove the uterus and you leave the ovaries, you're still going to have the hormones being produced, but there won't be any blood or no chance of pregnancy. Yeah, and it's interesting, hysterectomy. It's a sexist, long story, women being hysterical, that's where it comes from. So it's a very jaded, bad part of our history when you look at some of the way women were treated. So these little follicles, we're talking millions in the fetus. And what you have here with these follicles, these eggs, is they're going to begin meiosis, but they stop in prophase of meiosis 1. And so they're still diploid in nature, but they've already started the process. And they just wait in suspended animation. And if you look at birth, you've already lost most of them. So at birth, we're talking about 600,000 of these. So already so many have have been destroyed. And then of that, remember, of the hundreds of thousands, only 400, if you do the math, are going to be used throughout your lifetime, from menarche to menopause. And usually one egg is popped out per month. But of course, if you have twins, fraternal twins, that means 2 different eggs. Identical twins is when you have one egg that splits. You can have twins or triplets, and so you could have sometimes 2, 3, and especially if they give you fertility drugs today. If you're an egg donor, you can get paid for that. They will give you fertility drugs so you super ovulate, so many eggs, so they're going to go in and collect them. It's good to have some spares if they're going to try to do some in vitro fertilizing. But normally, you say 1 egg, and there's some thought that the right and left ovaries alternate ovulation. What happens to all these ones that didn't make it? Well, they just degenerate. Yeah, they just die. They just get reabsorbed. And then once menopause hits, all your eggs are gone. So you had 5 million to start, you're born with 600,000, and then you can use 1 a month from puberty to menopause, 1 or 2 a month, and that's it. So the primordial follicle, when you hear that primordial, I think of primordial ooze. This is the very beginning. So these things, again, they've been arrested, they've begun meiosis, but then they just stop. They stop, right? They don't continue going. And they're surrounded by just some squamous cells, just a small amount of follicle. But all the eggs have follicle cells surrounding them. But these are just tiny. And you've got just thousands and thousands of these primordial follicles. But some will be stimulated to start developing. You guys, what hormone do you think from what gland would start development of some of these follicles? I hope you're thinking follicle stimulating hormone from the anterior pituitary gland. And these will encourage these to develop. And interestingly, once ovulation occurs, or actually once the follicles grow big enough, they're producing enough estrogens that actually inhibits follicle stimulating hormone. So once you have a bunch of follicles beginning, you don't want more follicle stimulating hormone. You just want those to continue. So it's actually held back. And then once you go through menstruation, then the estrogen levels will drop again, and more follicle stimulating hormone will come, and more follicles will be stimulated. So there's this back and forth. You want follicle stimulating to begin this process, and then you want to hold off and then start again the next month. And you look, we have a primary follicle, and then it's going to have a secondary follicle. It's going to start developing this lake, this fluid inside of it. You can see the primary has several layers of cells now. These cells start dividing. They're little hormone machines making mostly progesterone and estrogens. By the time you get to a mature follicle, and the star of the show is the egg, the ovum right there, right? But it has a little crown of cells around it. See this corona radiata, and it's on I love the names here. They're very colorful. The cumulus oophorus. It's like the cumulus clouds, little cloud that it sits on. And then liquor folliculi. That's just fun to say right there. Look at all that fluid right there. So you're looking at that, you're like, oh, that one is ready to pop. That's going to ovulate, that one. Beautiful micrograph. You can see some, we're looking at a secondary follicle here. We're just about at a mature follicle here, aren't we? And then you can see, yeah, these primordial follicles, right? Tiny, small, thin layer of cells around them. Cumulus oophorus, again, is this little cloud, like a pedestal that the egg sits on top of. And the egg, I'm not going to ask you this, but it has a little layer around it that the egg's going to have, the sperm's going to actually break through. And then corona radiata. This is the crown around it like this. So you can see several cells. And when this thing ovulates, it's going to get loose from that pedestal, and it's going to keep that ball, the cells around it as it comes out. Ovulation happens mid-cycle. So you can expect it around day 14. But women are different. It can vary. It can vary one way or the other. There may be a little bit of pain, a little bit of blood even at this point, or sometimes you don't even know you're ovulating. It gets freaking big, 10, even bigger millimeters. I mean, this is visible. So if you look at an ovary that's about to ovulate, you're going to see a bulge on it like this. You're going to see a bubble. And it's mostly fluid, and the egg will pop out. And the egg is big, too. The egg, remember, it's not evenly divided from that original cell. Like sperm, the original stem cell became 4 sperm. The original egg cell became just 1 egg, and then 3 little polar bodies, these little waste that comes off. So the egg is big. You can see it pop off like this. You look at a cadaver ovaries, they look like the moon, all these craters on it, red crater around there. I imagine someone that was on birth control or prepubescent would be smoother because it wouldn't have all these scars from the ovulation. And what causes ovulation? There's in your anterior pituitary, luteinizing hormone, LH, is going to build up, and then it's released, and so there's this surge of LH. That causes the ovulation, the fluid and the egg get expelled into your abdominal cavity. Oh, just beautiful, beautiful pictures, huh? Look at that mature follicle. All that fluid in there. Look at the egg surrounded by cells. And then remember, these cells, there's different layers, these thecas, we don't talk about that in any detail, that are producing the hormones that go into the bloodstream that are going to have all their effects. So comparing males and females, the egg development from the sperm development, there's several differences, so make sure you guys are clear on that. One thing I just mentioned is that you get 4 equal-sized sperm. But in meiosis with eggs, you get 1 big egg. And you need it to be big. It has all the cytoplasm in it. The sperm's going to contribute some DNA. But remember, like things, organelles like mitochondria are from the mom. They're maternally inherited, with a little exception. I told you some latest research. But most of the organelles come from mom in the egg. And the sperm is just providing that little bit of DNA. So the egg needs to be big. And the other big thing, of course, is that sperm are produced every day in men. Sperm. Remember, you got 9 meters of seminiferous tubule, just making sperm constantly, millions, hundreds of millions. Eggs are not. Eggs, they actually sit in your ovaries they're made before birth. And then it's until puberty starts, we're talking over a decade, right? And then if you were to have a child when you're late 40s, those eggs have been sitting in suspended animation. They begun meiosis, but they didn't finish it for decades. And that's why you do have a risk, definitely, for Down syndrome or other chromosome issues with older women having babies. Less so with men because it's made, although I've read some things about older men and sperm, but I'm not sure that's really been settled, but definitely women, as they get older, their risk of having chromosomal abnormalities goes up. And it makes sense because those eggs have been sitting there for decades, which means they're exposed to toxins, to radiation, things like that. And so these eggs can have problems with their spindle apparatus, so the chromosomes don't move properly. So definitely explains something. The sperm are made fresh constantly. The eggs are made before birth, all of them. And they sit there and wait. All right, corpora. Corpse means the body. So we'll talk about corpus luteum and corpus albicans. So that follicle, remember, I don't need to draw it all, but here's the egg. It's got surrounded by cells, this little cloud. And then all around this fluid is going to be layers of cells. And these are the follicle cells. And they grow quite thick. And then when that egg is expelled, what's left is going to be this, just kind of this structure with all these layers on it. And it still may have a little bit, if we do some of the fluid in here, it'll have like a little cavity in the middle. But this whole thing is going to be, this body is going to be all those cells. They don't just give up once the egg is released. They become the corpus luteum, the yellow body. And actually at first, look at corpus hemorrhagicum, where they actually, because blood, it's kind of violent. This ovulation, the egg comes out, there's going to be some blood, but that quickly heals. And you get this yellowish color. If you remember, progesterone, estrogen are steroid hormones, which means they're made from cholesterol, lipids. And so it kind of makes sense to me in my mind why they'd be yellowish in fresh ovaries. Cadavers, they lose this color, but you look at a fresh ovary, you can see this yellow body. I'll show you a nice picture. And this corpus luteum is going to continue to pump out hormones, especially progesterone and estrogens. It's going to pump those out into your bloodstream. It goes and it goes and it goes after you ovulate, day 15, day 16, day 17, day 18, 19, 20, 21, 22, 23, 24, 25, 26. By the time you get to the end of your cycle, 2 weeks later, if it hasn't had a signal from your uterus saying that you have a fertilized ball of cells implanted, it gives up. And it is going to just collapse and just die off into this corpus albicans, this white body. Now, if you did have, on the way down, your egg that just left got fertilized, and by chance it implanted in the uterus and it developed a placenta, and you got a couple of weeks to do this, it's kind of, you have to make sure you do it in time, that placenta and the fetus will give off hormones, especially this HCG, and that'll come back to the ovary and say, corpus luteum, we got a bun in the oven, all right? We need to keep this, do not stop the hormones, because we need the uterus to not slough off. We need to keep it there because of a pregnancy. So it waits, and if it gets the signal that there is in fact an implantation, that you're pregnant, the corpus luteum will hang on for months producing these hormones. So the placenta and the fetus will produce hormones too that's involved in this complexity. So there's a fresh corpus luteum. And you can see, like I say, this used to be the antrum, used to be filled with this liquor folliculi, this fluid. And the important part of it are these cells here. You can see these cells out here that are going to be producing the progesterone and the estrogen. Here's a look at an ovary with a bunch of corpus lutea. Probably looking at a cat or a dog. I keep saying that because cats, dogs, squirrels, pigs, what kind of litter sizes do they have? Usually half a dozen or a dozen, right? So you're going to see an ovary like this. A human ovary, you're going to see probably just 1 or 2 corpus luteum. Yeah, and this states that HCG is a human chorionic gonadotropin. I believe that's correct. That's given off, like I say, by the placenta, and as the fetus, you grow this placenta to connect the mother's blood to the fetus. And this is also the hormone that's used in a lot of pregnancy tests. When you pee on it, if you find HCG, that means you've got something developing there. And it tells your ovaries you got something developing. It tells your corpus luteum, hang on, keep producing progesterone. We need this lining to the uterus because we're going to need it for another 8-9 months. If not, it doesn't get the signal, then the uterine lining is going to slough off. You're not getting pregnant that month. That corpus luteum turns into this white body, corpus albicans, and that just turns into just scar tissue in your ovary. Here's a corpus albicans. It's not very interesting. Oh, what a great picture, huh? Human ovary too, very cool. Look at how yellow, huh? This is a fresh ovary. And then we got some corpus albicans too. Yeah, you see the whiteness there. Those would be older. Those are from previous months. Beautiful. Look at that big. All this yellow tells me it's filled with lipids, and it's going to be making hormones, steroid hormones. All right, from the ovary we go into a duct system, and this has 3 terms that are pretty common. I'll go oviducts, but you'll hear the olden times, right? Fallopian tubes, right? And then uterine tube too. I see all three of these being used. But this is a short tube that is going to bring the egg from the ovary to the uterus. And if I ask you, where does fertilization take place? Where do sperm and egg meet? Well, they meet in the very beginnings of the oviduct. That's the usual place. And so the sperm need to make their way all the way up that oviduct. And I talk about a mystery here. You guys can do some research on your own, but the issue is you have cilia in the oviduct that help deliver the egg downward. And the sperm, they cannot possibly swim enough to make it all the way up that oviduct in time, right? Think about how tiny it is, and it only has, a few days. The trip down is only about 3 days, the egg making it down the uterus. So it's not going to be able to swim up there on its own. So there's muscular movements. So there's cilia coming down, muscular movements, but the sperm make it. Obviously, you guys are listening to me, so made it at one time in the past. Made it up here for fertilization to take place. And then the egg is fertilized by one sperm, and it starts dividing into 2 cells, 4 cells, 8 cells, 16 cells, into a ball of cells. And it takes about 3 days to make this trip down to the uterus. And I'll show you, it purposely makes a slow trip down there. So by the time it makes it to the uterus, it's already a ball of cells. Beautiful. This shows here fertilization. We'll call that day 0. You can see that the ovum is ejected, the egg is ejected from the ovary, and the Fimbriae are little fingers that are on the end of the oviduct. So the Fimbriae are little fingers, and on the fingers you have cilia, little microscopic cilia, and the cilia are beating and sucking the egg in. So the egg is released from the ovary. They're not connected. Like, you could connect the oviduct and the ovary, but they're not. There's a space there. In ovulation, it's thought the oviduct, the Fimbriae, get even a little bit closer so that the egg makes it where it's supposed to make it. Sometimes it doesn't. Sometimes the egg just gets lost. But if the egg makes it down into the oviduct, sperm are on their way, have been on their way up, and they'll fertilize it here. And you can see fertilized eggs. It's going to start dividing. Look at that. So by the time it gets to the uterus, it is already a nice ball of cells. Yeah, like I say, those Fimbriae, the oviduct moves a little bit closer during ovulation, that pulls back a little bit. The oviduct, you can see some different anatomical terms. We talk about the infundibulum is like a funnel, and it has Fimbriae on it. And then the ampulla, just like the ampulla on the vas deferens, is a wider portion. And then the isthmus is where it gets narrow, and just before entering the uterus, that we'll talk about later. So here's just a big view. You can see the ovary here, and then it just shows you the little fingers of the Fimbriae right next to it here. And then looking here, this is the inside of the oviduct. See how complex it is? I'll show you some more pictures. Another close-up, seeing the Fimbriae. It's going to be cilia on there to suck the egg into that tube. And then the layers of this, you guys, this shouldn't be nothing new to you. You've got a mucosa on the inside, muscularis, smooth muscle, and then a serosa, the connective tissue out there, blood vessels and nerves, everything like that. Mucosa, quite complex and folded, isn't it? Look at all those folds. There'll be columnar cells in there. There'll be little cilia that'll be beating and transporting the egg. Because the egg, how's it going to get down there? It's either going to be muscle or cilia. It's actually, it's the only way to get down because the egg can't swim. Ah, beautiful view. That's just so complex right there. Purposely complex. And this explains why. Why is it so convoluted? You actually want to allow fertilization to take place in there. You don't want the egg to just fly down that tube and out, right? It's got to have time for the sperm to get up there, and then you want it to develop. If the egg just reached the uterus in like the 2 or 4 cell stage, it's too early. It needs to be already a ball of cells because it needs to implant. And we don't get into pregnancy. We don't have time in this class, but it's got to implant, and it's got to start developing a placenta and starting to develop that little tiny embryo. And so it needs some time to develop before it gets there. And so we believe that it's really convoluted, so it kind of slows it down. On the isthmus, you can see that much thicker layer of smooth muscle, and the mucosa is not as complex. And looking at it, you can see all the little cilia. And the 2 kinds of cells here would be the ciliated cells to move the egg down, and then there'll be secretory cells too, kind of like goblet cells making mucus, but they'll be producing fluids that come out into the oviduct. And in fact, cilia were not first discovered maybe like in your trachea or in your nasal cavity. They're discovered in the oviduct of a chicken. So that's where these little cilia first developed. And actually, you guys remember, I think last semester, I asked about, we're talking about the cell. If a person had a disease, a genetic disease where the cilia were not motile, they didn't move, what would that affect? And I would say some of the symptoms or signs would be it'd be difficult, like coughing a lot because you're not getting rid of the crap in your lungs. And the females would be infertile because the egg wouldn't be carried down without the cilia being moved. Oh, just gorgeous picture. Look at that cilia. You can imagine them beating and beating, moving the egg along. Oh, and another one, electron micrograph, you can see you have cilia cells, and then these other ones are just going to be secreting fluids. Well, talk about birth control at the end of the next lecture, but one very effective method is tubal ligation, getting your tubes tied. So women, if you have that oviduct severed or tied off or clamped, the egg cannot make it down. So you ovulate every month, just the egg doesn't make it down to your uterus, so you cannot get pregnant. Looking at its different statistics, we're looking at, I think in the US, 27% of women, 33% looking worldwide. So once you decide you're done having kids, this is a good method of sterilization. Vasectomy actually is even easier. Everything's out on the outside, it happens really quickly. This is a more expensive procedure, a little more chance of infection because you're in the peritoneal cavity, so it's actually a little more complicated, but it's very effective and not quite 100%. There's just been cases where sperm have made it through and the egg has made it through, but there's got to be an issue with how it's done. It doesn't usually scar tissue forms, and it's not going to be a blockage, but tubal ligation is certainly an option. And they can do it laparoscopically instead of having to make big incisions. They can get in there various ways and cut a piece of the oviduct, cauterize it, or put a clamp on it. It has bands on it, and you're done. You're done having kids. And a hysterectomy would remove the uterus. That would work too. All right. Well, I hope you've learned some things. Talked about ovaries, about ovulation, a little bit of the hormones involved there, and then we've moved to the oviducts. And now the last lecture, let's get to the uterus, vagina, and then we'll do some other topics too.